The Kano branch of the Nigeria Labour Congress (NLC) has shelved its planned strike action in the state over the state government's deductions from workers' March salary. NLC Deputy National President Najim Yassin said at a joint news conference with other labor movements and affiliates in Kano on Wednesday night that the organized labor has suspended the three-day warning strike earlier scheduled to begin today, Thursday, in Kano State, after a meeting with delegates from the state government led by the state head of civil service, Binta Lawan Ahmed. Yassin said the peaceful protests scheduled for Monday have also been suspended. The Nigeria Labour Congress had given a 7-day ultimatum to the state government last week to refund what it called the illegal deduction from civil servants' salaries or face industrial action. The labor leaders also threatened workers would embark on a 3-day warning strike from midnight Wednesday if the government failed to stop the unexplained deductions before the end of its ultimatum on Tuesday. Now, the labor groups say they had reached an understanding with the state government. We'll be right back.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network, ANN. Watch ANN News on MITV from a truly African spirit.
The Kenyan government has denied reports of death from COVID-19 vaccination, during which more than 300,000 persons have received their first doses of AstraZeneca vaccine in the country. Kenya's Drugs Authority denied that a Kenyan had died from taking the AstraZeneca vaccine. Deputy Director of the Pharmacy and Poisons Board, Dr. Peter Ikamasi, said the death of a Kenyan health worker who had taken the vaccine may have been caused by a miscarriage. The deceased was a nurse working in one of the hospitals in Uasin Gishu in western Kenya. The World Health Organization recommends that expectant women should receive the vaccine only if the benefit of vaccination outweighs the potential risks, such as if they are health workers at high risk of exposure or have conditions that place them in a high-risk group for severe COVID-19. The Pharmacy and Poisons Board said characterizing the adverse event that followed the immunization of the nurse as fatal was misreporting. The board said all reported cases that have adverse event after immunization are under investigation, and none of them has resulted into fatal outcomes. Data from the board show 279 persons have had adverse effect after taking the vaccine. 7 are experiencing severe symptoms. Kenyan Health Ministry says it has also not recorded any rare cases of blood clots, as is being reported in some European countries. That is ANN News Brief at 1. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Lucy Adeyemi.